Hi, this is Dr. Ashish Day and I am a senior consultant in Department of General and Laparoscopic Surgery, Sir Gangaram Hospital. I have a special interest in hernia and today I am going to very briefly tell you about what exactly is hernia, how we do the surgeries and what you expect out of it. Well, what is hernia? It's a protrusion of intra-abdominal contents through a defect in the abdominal wall musculature. So that can be either a loop of intestine, or it could be the intra-abdominal fat, which we call omentum. Now, what happens if you don't operate? If you don't operate, the hernia keeps on getting bigger and bigger, and at some point of time, it might end up in a certain complication. So, no surgeon will tell you to sit with a hernia and not do anything about it. A hernia is a physical defect that needs to be fixed. Now, if it happens close to your groin, which means in the inguinal areas, they are called inguinal hernias. If they happen anywhere around the umbilicus, above or below it, they are called ventral hernias. They might occur primarily, or they might occur because of weakness after a previous surgery. In any case, they need to be fixed. We can do it open, we can do it laparoscopically. Now, laparoscopic repair of ventral hernias, they do have their own advantages. We have to reduce the contents, we have to fix it, close the defect, and then put in a large big mesh. So putting the mesh will prevent recurrences, and no hernia surgery in this date apart from children can be done without a mesh. So a mesh has to be placed and it has to be fixed to prevent the hernia from recurring. Now, mesh is a foreign body, of course, and it is not absorbed in the body. It remains there throughout life. It kind of gets integrated into the body, but it remains there and prevents hernia. So, laparoscopically, it is very possible to put in a large mesh around the defect so that the chances of the hernia coming back are reduced to a large extent. For very complicated large hernias, we now have component separation techniques. We do it laparoscopically, and to ensure that we can put in as wide a mesh as possible. And the advantages are that the patient does not need a big cut. They can ambulate, which means they can move around right after the day after the surgery. They are discharged early, and because they stay in the hospital for a lesser time, so the other complications are also reduced to a large extent. How can you contact me? My contact details will be at the end of this video, so you can contact me either on phone or by Gmail, and we can come and talk and then discuss your problems and your queries in my clinic. Thank you so much.